and this is the late one coming at a later time tonight of 10:30. Well, actually 10:33, and I said let me go late before you guys go to sleep as we do a quick update tonight as to what's going on in the UK, what's going on in the world, but especially COVID-19. And as you can see on my screen, what I've done is update on PPE and more with ophthalmic surgeon, Mr. David Burton tonight. If you recall, David was on my show recently, and we were talking about the various aspects of COVID-19 from a professional perspective, instead of going around talking about what we think and what we know, but giving it from a professional perspective. I think that is very crucial. Today, as you may have seen in the news, and if you follow the update from the government, Chancellor Sunak warns of tough times for the economy. Now, this is more than just what we say, the people are getting sick, but there's another warning which is coming through. Tough times for the economy. The double sick now, which is going on. But, before I go any further or whatever like that, let me just bring in David, because I want to really get this one going sooner than later. And I'll bring in Sir David Burton. If you recall from my last show, David is a GMC registered consultant. He's an ophthalmologist working in the NHS, worked in several regions in the UK, including Yorkshire, Northwest, Midlands, and London. Keen interest in postgraduate medical education, to bridge the gap by conducting health forum within the Black community. If you recall, his wife was with me, and but all of us on Dr. Carla Campbell Burton, an epidemiologist, right? So, David, good evening. How are you?
Good evening. How you doing?
I'm good. I'm good. Well, thanks for the late time. David, one of the things that you and I was looking at recently was the talk of looking at some different talk shows where persons were saying we're making pronouncements that COVID cannot affect certain things. Okay, we know they're saying COVID cannot affect young people. Young people are getting crazy and just say, life goes on.
Right.
There was a perception that COVID cannot affect Black people, so Black people. So lots of talk shows saying we got melanin, all those sort of things, and we're finding this. We won't touch on it now, but we're finding that the disparity. We're seeing doctors, the medical persons who recently are being killed as a result of COVID in the UK is not in proportion to the NHS to a certain extent. In America, we are seeing a lot of Black people being killed, as a result of COVID. So it actually makes us start to wonder what is really happening. Nevertheless, David, one of the key things that we were talking about last time was an update on PPE.
Yeah.
And things that we wanted to talk on. There's a couple of things tonight, just to zero in, because we set the stage the last time.
Sure.
How are you? Tell me. And,
thanks for again coming on to your show today this evening to talk more about the sort of COVID and the effects of COVID. And one of the biggest things that's facing us right now in, I think, the health profession is this personal protective equipment. The issues surrounding that. What you've got here is we've got two hands. On one hand, the government is saying we've got enough PPE. It's getting farmed out to the hospitals. There's helplines available. If the hospitals are strained, we can get on top of the PPE. And on the other hand, you've got doctors on the front line saying, look, we've not got the PPE to hand, and we need to get it to hand. And we need it to protect our patients. We need to protect ourselves so we're not passing on any unknown infection. And that sort of relays back to the testing line. Now, the thing here is I think the discrepancy could be nipped in the bud by simply saying this. I think the doctors, and I can't speak for every doctor that's out there on the front line, but I think overwhelmingly there's a sense that the PPE that we have isn't sufficient and fit for the purpose that we need it for. So a couple of things have developed since we last spoke.
Yes.
The Doctors Union, the British Medical Association, and the Doctors Association for UK Doctors have both come out in support of doctors across the UK and saying, look, we're hearing from our members that we're not hearing good things on the ground in regards to the PPE and the adequacies of PPE. And we need that now. We don't need it yesterday. We need it now in order to protect, again, our patients, and to protect doctors from working in environments where we know this unfortunate sort of situation that we find ourselves with COVID. We need that protection, and we're not really getting. It seems like we're not getting anywhere in that regard. And looking across the board, I know that PPE is a problem across the board, in other countries as well. They're having their own issues, but we have to really look at home and try and get on top of that. So I would really express my concern on the PPE issue, and I would ask people listening in this evening to lobby your MPs about this particular issue. Talk to your MPs and see if you can try and drive home this issue regarding PPE, because essentially we need to protect the care workers that are in the jobs that they're doing, whether that's frontlining in the hospital or in care homes across the UK, where this is becoming increasingly an issue. And we've known about this issue now for many a week, and we just need to try and get on top of this. I think we can do that with the public's help.
And it's interesting you mentioned about, you said lobbying your MPs. People must be saying to themselves, wow, does that exist? Because you're not seeing much lobbying efforts or government, the work of Parliament. That is why the new leader for the Labour Party, Sir Keir Starmer, he's talking about we've got to get back Parliament in some way, some sort of accountability. Because right now, the level of accountability is the, what should I say, the so-called reporters questioning the Prime Minister's team when they have the daily update. The interesting thing about the PPE is that it wasn't something which was so talked about in the early stage. As we said before, there's no need. Is it the fact that there wasn't the push or seeing that as something of any key nature? That is why when professionals, not like you, but we have lots of medical professionals were saying, you don't need gloves now. No, you don't need the mask now. Mask is only if you have it and you're passing it on, but you don't really need it. But now it's completely changed, David. Is it that the thinking for that before wasn't there and it's caught off guard?
I think there's a multitude of reasons. I think we were caught off guard as a nation. I think the government was definitely a little bit slow in trying to get to grips with the particular issue at hand. I think as more information comes to the head, then we're able to obviously make judgment calls. There was definitely a lack of supply in terms of getting it out to the hospital and such, and we've known that for a little while now. I think that's the key issue here. We've known it for a little while. This isn't yesterday. This isn't last week. This is a good month or so now where we've had 3 weeks of lockdown. We've known that PPE is an issue. And I can completely understand from a government's point of view in terms of trying to get this on board. It's a very difficult thing to do. But at the same time, I do, and I think I mentioned this last time, I do look at the ability of a nation to try and provide for its people. And in doing so, we should be able to make the equipment. Now, I know for a fact, you've heard, you may well have heard in the press recently that there are many different providers who are trying to make surgical scrubs, so kit that we can wear in the hospital itself. So, ASOS is one of those things. I'm not advertising them, but my point is I've heard through the news media, the media sources that they're actually making, surgical scrubs kits. So again, why can't we just get people to turn over and make the kit that we need in order to fight this virus, and put that in the hands of the people who are trying to fight this virus on the front line? And that's essentially what I'm saying here. I completely get that things change over time. Information is always, being assimilated in regards to the how this problem is manifesting itself. But we need to get that kit. And again, I can only ask that in terms of what people out there can do, and the tremendous work that's obviously been done in terms of trying to support local communities. But the biggest thing, I think, one of the biggest things that people could do is start lobbying. And I do think that is a productive thing. People, MPs will listen and they'll try and feed that back up as much as they can to try and get that dynamic change, for the betterment of the healthcare workers across the UK and further on. So yeah, PPE matters for sure. We need to get on top of it, and that will filter down to the UK majority when we need it as well. In terms of face masks, if that's something that's going to come into fruition later on down the line, if people are going to have to be wearing face masks, I'm not saying that's a given, but what I'm saying is if we can get and generate the production now, it serves that purpose in the future, so people aren't fighting for them or paying ridiculous amounts of prices for them if they need it in the future.
I mean, I've got persons,
matters.
yeah, I've got persons from Jamaica even talking about importing, exporting things to us as well, But something, something, ladies and gentlemen, something tickling in my throat. I think that's COVID, man.
So all this discussion of COVID, just sets the alarm bells in the mind. You see?
Yeah. But we've got a situation now where things have slightly shifted from the NHS, whereby the PPE is a big factor also in the care homes. Where they're saying there's a whitewash of the amount of persons in the care home which have been passing away. People have been using bin liners. Somebody just asked, how was the government caught off guard? How are you guys caught off guard?
So I think the government's probably been caught off guard somewhat because of difficulties in funding an institution. Okay, however you want to talk about those difficulties, I don't really go political on this. But there's issues particularly related to funding. I think the due diligence was actually done a few years back in a sort of a test exercise in regards to preparedness and discussions about preparedness. You can go on sort of YouTube and look at the government's sort of position on things. Preparedness was always discussed. It's just in terms of accelerating that drive, I think they've been caught off guard because this is a global pandemic. And this is something that's affecting it's touched every part of the world, and everybody wants a piece of the PPE, the test kits, and so on and so forth. But what I think, learning from this, what we could do going forward is make sure that we have a disastrous plan. And whenever this unfortunate thing occurs again in the future, we can learn from that. Now, in regards to the care homes and the death rates there, it's obviously been well articulated that some of the data coming out of the care homes has not been put into our official data in terms of how we put that out in government. And I think one of the reasons, one of the reasons that's been is put forward for that is that other countries tend to be sharing more of the information regarding to the deaths occurring in hospitals. No doubt, all death matters, and we need to make sure that we collaborate with the care homes to get that data together in order to sort of make sure those people aren't forgotten. They're not airbrushed out of future sort of plans and such. And I think that the other thing to say with respect to care homes is I would hope that those people who do pass away in the care homes were afforded the option of going into hospitals, and that wasn't a factor in that regard. But I can't comment any more on that. But I keep coming back to it, and I know this is a common feature, but we need to make sure in terms of the care homes, people in care homes generally don't come out of the care homes, generally speaking, and so we need to make sure that those persons in the care homes are properly tested, and also that the people who are looking after them have the appropriate PPE.
Wow.
And that's just a thing, really. And it's a poignant point talking about people in the care homes, because any loss of life is a sad affair. But again, we need to make sure that they're part of the figures.
Yeah. One question just asked, even though everything's all linked with COVID. The concerns about reinfection, I believe, it's some of the country that they're talking about where there's concern about reinfection. Even got colleague of mine in the UK said he think he had it about 3 times already. Charles,
I think that's quite a lot in the space of the month that has just passed. But, it is a cause for concern. Again, I think in anything here, we need to have the data to back up and support that issue. And if you've been tested, you've tested positive, then you've completely recovered, and then you've had another issue with respect to flu-like illness, and it's tested again for positivity, then that's one thing. But I don't know that has been definitely proven. I think I've talked about this sort of positivity in regards to tests, and that sometimes you can test positive for something and you actually don't have the condition. Sometimes you'll test negative for it and you actually do have the condition. This may well be a reflection of that in some of these circumstances, that people have been incorrectly diagnosed, or have been not been diagnosed and then diagnosed later on down the line. All of that feeds in, really. But yeah, interesting one.
Yeah. Ladies and gentlemen, I want to thank you so much for coming on. Welcome to the late one at a later time with Dr. David Burton, GMC registered consultant ophthalmologist, working NHS. Also, one of the reasons why I came on late today was because I'm working around this time, because, you know, healthcare for persons on the front line, we got to grab them as we get them, you know. So David, please share this video if you get it, and any questions you can ask, please shoot them and we can do that. David, there's been a recent request by the government, and you can hear it on the news and everything like that, that persons in the NHS or previous doctors, elder doctors, please put yourself forward. We are calling and all those sort of things which is happening. David, what we're getting is that the over 60 or so are more affected by COVID. In the medical field, there are now lots of questions and queries. They're going to do investigation as to why so many Black persons have died. And this is the double whammy, because at the same time, they're trying to get all the folks in, and we're finding that all the folks are dying, right? Can we do some sort of thinking in that? I know you got a view on all of that now, but, you know.
Sure. So I mean, there's no doubt that there's an initial sort of cohort of people who were passing away, unfortunately, through to COVID. There was a disproportionate amount of persons from a Black and African Caribbean and Asian background who were passing away, as I say, from COVID. And this struck alarm bells, and still strikes alarm bells amongst the medical profession. So much so that the British Medical Association have made this a point of concern and commented on this, and want further information in regards to why there is this sort of disproportionate effect on people from that particular background. Yeah. Now, I think there are an array of reasons as to why that may well be the case, but these are speculative. I'm a practitioner of medicine, so I'm a scientist at the end of the day, and I'd like to have the facts and figures in front of me. And the fact is, we need more information as to why that may well be the case. But there are speculative reasons. One of them is that, and I will comment on them because the BMA has done that in the past. So one of them is in relation to the ability to speak out. And I think that people of a BMA background may well not have the confidence to speak out if they feel that they're getting inappropriate sort of PPE. One of the other reasons that is being looked into at the moment through a DNA point of view is to see whether and why it is that people are more affected than others. So whether that's from a racial point of view, which it may well or may not be, but also from just the core sense of their DNA, because we know that some people just aren't affected. Some people have very mild symptoms and may not even know that they've had the particular bug, whereas others have a horrible course of journey through having the disease, being admitted, and unfortunately passing away with or without comorbidities. Comorbidities being things like high blood pressure, having an excess BMI, which is tending towards being overweight, etc., etc. So, or having underlying lung problems. So, there are research groups looking into the DNA aspect, and that may well give us and shed a bit more light. But the one thing I will say about race here is that, you know, I think that COVID sees no prejudice. Okay, it's affecting every country in the world. Okay, and one of the figures I want to give to you today is that in Italy, just in terms of doctors, over 100 doctors have died through this condition. Okay, 100. And I've not looked at the ages of these doctors, but 100 doctors dying of a condition related to a disease in trying to serve the patients that they want to look after is unparalleled. I've never heard of that before. To put that into practice, that's around about a third of the intake of a medical school. A third for a medical school. That's unbelievable. And
you know, You know what, Dave? You know what would be so good if we could get even eventually, when we have a further conversation, is of that 100 in Italy. What was their age range? We
Yes,
can
exactly.
that most of them
And
are
it's quite
yeah,
tricky from my point of view to do that. A lot of the literature is all in Italian, so I've been using
yeah,
Google Translate to try and. But that is a factual bit of information there, and I just think, well, actually, the core context of this is how are these doctors being looked after in the country? Okay, do they have the adequate PPE? It keeps coming back down to it, but do they have the adequate PPE to protect the patients and then protect themselves from passing it on to other patients? And I think that's the core construct of my discussion and my argument here, that falling back to these patients and these doctors and patients obviously who passed away, but these doctors we're talking about now, the disproportionate number, did they have the adequate PPE? And that's a question that we'll have to get to grips of maybe after this pandemic, but also we still need to get to grips with now, because doctors are still on the front line trying to deal with this particular problem, and that's the key.
yeah. And what we're seeing as well, I mean, there are some pictures which just coming through at some point from Italy at the start when the people were just dying before us. They were showing doctors overwhelmed, exhaustion, lying on the
Sure,
ground. I'm sure it wasn't for a photo call or so. They're literally overwhelmed. And
sure,
I think in that process, it will cause contamination and everything. I mean,
there'll be
I always, yeah,
lots of issues here. Exhaustion, fatigue. Adequate intake of fluids, eating, sleeping. All of those things that are things that we can bear in context with all of this.
yeah,
Yes, age is an issue. When I look through the people that have been affected in this country, in terms of doctors, healthcare professionals, nurses, physios, pharmacists, the list goes on.
yeah,
Age seems to be a trend, but the numbers are small. And race does as well. But the fact is, I think we've got to look at the people who are on the front line. And going back to your key question about the people that we're bringing in, we've got to think about really think about where they are positioned in this journey. Are they on the front line, or are they on wards where COVID is not an issue, looking after patients? And I think
there-
in that respect, that's probably be the safer aspect. But I can't give you that answer
yeah.
as to whether they are where they are in the journey.
Yeah. As my opening monologue, when I mentioned that it seems like uh, Black persons seem to have been a raw deal, it's showing what is happening in the States. We discussed it before that there's an economical factor
Yeah, for
whereby
sure.
it deems that they're not able to get that care. But now what we are talking about, and as someone just asked, the underlying factors as well, is it that more Black people are prone with underlying factors that affect us?
Well,
Um,
that's a good question. I mean, in terms of the underlying factors, I can't speak on behalf of the doctors that have passed away,
yeah,
unfortunately, through this horrible virus. But we do know that it's more associated, or death is unfortunately more likely if you have comorbidities. But not having a comorbidity does not protect you against it.
mm,
To answer the question broadly, nobody knows in terms of whether there are racial differences, but I'm just projecting the fact that racial differences aside, because this virus seems to affect everybody, and I think if I want to take home message from today, aside from my PPE issue, it's that being of any particular race is not protective against this particular problem.
right.
Not protective. I generally don't want to hear that melanin protection idea at all again,
Yeah.
because that's dead in the water to me.
Do
What
you, do,
matters is that if you go on.
mm. No, no, no.
But
Straight.
I
Finish
was
what
going
you
to say
said.
what really matters to me is if you feel you have this particular problem, if you have a persistent cough, if you have a persistent fever, that you seek medical attention. Simple as that.
Do you think that I'm not blaming, as you say, no respect of persons and
Hmm.
just left, right, and center? People blame government, but do you also believe that the persons who are going around saying that this doesn't affect Black people, and as we were looking at the video earlier with that discussion,
Mm,
and someone
mm,
speaking with confidence as a raft of it, do you
mm.
think it contributed to the mindset that made persons sort of throw off restraint and want to just go prolong without taking those precautionary measures?
Yeah, I mean, two things.
Mm.
Information always gives rise to wisdom, I think, and obviously it depends on the type of information that you get. But
Yes.
misinformation definitely does breed more sort of mistrust in particular agencies, and whether that be a mistrust of doctors, of healthcare professionals, etc., then that may well have happened. I don't think it's going to help the situation whatsoever by saying something that is completely untrue. We have to nip that in the bud, and we have to move on and make sure that people are aware that essentially, if you have symptoms, then you need to seek help for those symptoms and not rely on goodwill gesture, that kind of thing, to get you through. Overwhelmingly, this problem has been found not to cause too much harm, in the sense that most people will have a mild to moderate episode of illness. So that's to be re-emphasized, obviously, but to feel that you are protected, that you need to not obey the rules that have been stipulated in terms of staying at home, isolating yourself from or obeying sort of social distancing because you have black skin is not the way forward, and it's never going to be the way forward. And I just want to dispel that myth.
Right. Do you think a lot of testing is presently being done, more priority on the medical fraternity, the front line? Do you think this is a swipe? I'm being a peer organ here. Do you believe that Mr. Michael Gove, he was isolated at home because his daughter was having what should I say, signs of COVID, and she got tested negative, and then he was back out jogging. So people are actually saying, is he on the front line?
Yeah, very interesting, isn't it? That's a real.
What do you think as well? Is the government on the front line? Yeah?
So, firstly, to say that this is obviously my personal opinion, not reflective of the medical profession.
I'll put the disclaimer at the bottom. No
disclaimer at the bottom, right? So, I think with regards to testing, if we're really struggling in the UK to test people, and we're putting persons in a hierarchical level, you've got to think, well, actually, as a society, what do we want in terms of that hierarchy? Are politicians ahead of Dr. X or bus driver Y? I don't know. So that's the first thing to say. I generally don't think that we have a complete lack of testing. I think we're trying to reserve the testing for future, for further down the line, okay, when we need it. And in regards to Michael Gove, I think he is obviously in a position where he can get the test. And I think one of the other things to think about here is not just Michael Gove, and this isn't a pop at anybody in football, but it seems like footballers tend to have got these tests. It seems like if you are a person who's an affluent position in regards to acting, you got this test. And it seems like frontline workers were kind of down the pecking order, which to me is not the right way of doing things. Does a politician count above a footballer? I mean, I tend to think possibly yes, because they're in a position where they have to sort of sort the country out. But at the same time, I do question where the tests have gone historically, in the past 3 or 4 weeks. We were hearing about footballer X and footballer Y and manager Y and, getting the disease before, these doctors. And I'm going to speak on behalf of doctors because I am a doctor, and I'm going to speak on behalf of the healthcare profession because I'm a healthcare professional. I do think that was something that was probably lacking. The foresight into who should get the testing was probably a little bit behind the pace. To counteract that, of course, I don't know how many tests were used in that particular realm, as in for actors and for footballers, etc. I don't know how many tests were out there that could have been used for the NHS, but even one test may well be too much in that regard.
It seems that the GMC or the Nursing Association within the UK is putting their foot down in certain way,
Most definitely.
That they are not somehow deemed to be treated with the utmost level of respect while they're on the front line. I think the Nurses Association or the nurses, I'd said something like, I'm careful how I say this. You can correct.
I can comment. So
that they
essentially,
won't Yeah.
Yeah, so the nursing association has basically come out and supported the nurses, which is at a time where support is crucial, because what you're asking people to do is to face up to the fact that when they're in front of a patient, what do they do if they find they don't have the adequate PPE? And Nursing
Yes.
Medical Council basically has come out in support of nurses and said, look, if you don't have the kit available that you feel that you deem is necessary to do your job, then feel free to down tools in that respect. And that is a really different, that's a horrible position to be put in, because you're putting the pressure on the healthcare professional to make that judgment. And that sort of detracts from the job that we all want to do. And it's all down to a lack of support through external factors, which when I signed up to become a healthcare professional, I didn't sign up to have a lack of equipment,
Yeah.
and I didn't expect that I would have to provide all my equipment for the job that I do. There's parts that I do provide, but there's parts that I would expect as in any job. And it's the same if you're in any job. You don't rock up to become a bus driver and have to provide the bus or the steering wheel or the tires. You expect that to be the norm so you can do your job. And so I wholeheartedly support the support from the Nursing and Medical Council. How that transpires is really the next thing, and I don't know how that's going to work.
Now I ask this question. Boris Johnson is in hospital. Just a scenario. Boris Johnson is in hospital on the intensive ward section there. The two nurses, one who was from Portugal, the other one is from New Zealand, was there for 48 hours. In the first 24 hours, they realized that they didn't have any PPE, more equipment. Is that a situation we're looking at where they say, listen, I'm not going back in?
I think he'd find that he'd get the PPE. It's Boris Johnson.
Okay.
But I take the point.
Yeah.
Point.
Bring it down to someone else then.
What would happen is, that's a personal choice, and I think I alluded to that earlier last week. It's a personal choice. If you find you've not got the kit available, I think you've got to escalate that up the chain of command and say, look, I don't have the kit. You've got to have the confidence to express this vehemently, that you don't have the right kit available. You do what you can and you move from there. But that's a personal thing, and I think everybody will make that personal choice in regards to the way that they practice. But again, we don't want to be put in this position. I can speak on behalf of the healthcare professionals out there. We do not want to be put in a position where we have to make that choice.
Yes.
And that's essentially it. And again, everything for me boils down to that issue of having the right stock, right kit, right supply to do the job. It's as simple as that.
So therefore, I think kudos to that gentleman. I think he's going on to his 100th birthday. He walked around his house, and he has got £1 million.
Amazing effort. I have to applaud that, honestly. Because, current climate, that's a real tricky thing to try and organize and to try and generate that amount of cash. Where people are struggling to make ends meet. There's obviously economic issues at hand at the moment, and to raise that amount of money, hats off to the guy. An amazing effort.
Yeah. And I think what the family said today, they were saying he's going to stand down now. They're passing it over to the nation now to work towards supporting the NHS. Going across our land of our fathers. I mean, while it's Africa, but we're talking Jamaica. Jamaica just undertake a telethon.
They did, yeah, fantastic.
Yeah, so Jamaica is actually, figures are low, but David, the fact of the situation for Jamaica is that it was at 1, then went to 2, 3, 4. Everybody was from overseas, and now it's at 60 something, I believe, or 70 to keep increasing.
Yeah.
But they went out on this massive launch to get a lot of money in order to get in a lot of PPE.
Yeah. And I think that's obviously required across the board. We talked about PPE in this country, and I think it's a great effort to have a telethon over 6 hours of entertainment for persons at yard and abroad. I think the thing is, I suspect that you will have more money going in. I know when I went to donate, there was an option to sort of give every month or on the screen. So they may well find that they'll get more money coming in. And I'm sure that the persons involved, the artists, the sports stars, etc., the poets, they'll be able to keep generating that buzz, hopefully, and drag some more money into the country in order to support the efforts of getting frontline key workers the protection they need to help in Jamaica. And I'm hopeful that, not just Jamaica, but maybe if they're able to help other nations within the Caribbean as well, because this isn't just a Jamaican problem. Yes, Jamaican parentage and etc., but it's going to be a Caribbean problem. So I'm hopeful that they'll be able to help across the board, and maybe be a centre to try and help other smaller islands to get those patients into the island to treat them possibly as well. But we'll see how that progresses.
One more question before we wrap up is there's also talk of more than one strain of the virus.
Yeah. So this is a really touching one. So back in early March, there was a forum set up against a forum that's freely available on YouTube.
Yes.
With Italian doctors from, I think, Argentina, the UK, all sort of respiratory physicians trying to figure out the best ways of dealing with this horrible virus. And what they were really looking at is who was affected. And Italian doctors essentially pointed out two big strains. There are more than two strains, but the two big strains were, one was affecting generally the older people with the comorbidities, etc. But there was also the unfortunate death of younger persons who had no comorbidities. And so there are, and again, that's the reality of this disease. It does change, it does chop and change. It does affect people more so than what the first thoughts were, and that's why we all need to keep with the mantra of staying at home, protecting the NHS, and keeping safe ourselves. But also, again, makes sense for us to get on top of the testing debate, get on top of the PPE debate, because we can then look to try and minimize the amount of people that will be affected to the nth degree. But yeah, most definitely there is more than one strain. There are several different strains, and that will probably give us an indicator as to which other strains we want to protect against in the future as well in regards to vaccination.
Well, I found this very key. We talk about the different strains, and when you got different strains, sometimes we talk about things developing or whatever like that. I saw a very interesting article there. And the article, I will just read right here. It is saying that, and I'm going to find it, rodents are becoming cannibals, right? As coronavirus restaurant closure leaves a shortage of scrap, expert says. And what it is alluding to, David, is that they're actually evolving and becoming a new type because there's no food there as restaurants before. They're eating themselves. They're becoming a bit more forceful. Then David,
okay,
I know you're not into political, you're not into we call it these conspiracy, but then I saw something else. Right. So the rats are eating themselves, the cannibals. Now Bill Gates, they said, may have created coronavirus to microchip people, and this is by Roger Stone. So some people are saying, my days, guess what is happening? The rats are ratting on themselves. Roger Stone is not any great name. And people are having question signs over Bill Gates. I mean, I posted an article up by saying, if this is a conspiracy theory, well, this is one I'd be more apt to believe. And I said this myself. I do not trust Bill Gates. Did they shut us off now? He's so much over this vaccine thing. He's all over and spending too much time in Africa. And I said, I smell a rat. And then after that, people started saying, can we trust Roger Stone? Well, I said, well, they're eating up themselves. And I saw this. The rats are actually eating themselves. It's like there's a exposure. There's a level of exposure which is happening. What's your take on it? As I said, I know you're not a conspiracy theorist, but I just
what I will say on this is that I'm using a Mac, so I don't mind talking about Microsoft right now. But I have no comment on the rats, and I have no comment really on Microsoft. I think that's something we'll develop. I think over time we'll be able to find out a bit more about how these rats change. Changes don't happen overnight. That's what I will say. But desperate times call for desperate measures, and I guess if the rats are eating themselves, then we'll see what happens with that.
Yeah. And any but let's go back a bit quickly. Let's go back a bit quickly. Because what they're saying, I think some countries are actually saying until we have a vaccine, then we open up, you know.
Yes.
Do you see any breakthrough regarding vaccines or so?
So I think there's been a lot of speculation on the vaccine and when that's going to be available. Vaccines can take a long time. We're talking many years to come to fruition. I think in this particular case, I will hopefully find that we'll get it maybe in the new year.
Yeah.
If not the middle part of next year. Now, I guess the fallback question is what happens between now and then, and who knows how we integrate back into society to live safely again, or as safe as we can until then. But I think that the vaccine is what most countries are working towards and are hopeful of getting and attaining. I would just hope that there's a fair way of getting that vaccine out to people that require it, because that's the next bridge to cross, really. We found that during the H1N1 pandemic, it was quite tricky for some certain nations to get hold of the kit that they required. So we'll just have to watch this space. Yes, I think that's where we're working towards, especially in the face of the fact that we don't know how long persons that are infected will have a degree of immunity. And once we are in a better sort of standing ground as to regards to that question, it will direct how much of a concern the vaccination is going to be going down the line.
Yeah. Ladies and gentlemen, Dr. David Burton, Mr. Burton, I want to thank him for coming on. I've actually, without talking about fees or anything, as he's our resident Dr. Hillary, we use our own to explain to us what we want to know and to be practical on the whole process at the same time.
I was going to say the fees are in education. That's all I command. That's fine. That's fine with me.
Fees are in education.
Right.
And next time, if he's not around, he will unleash his wife, who is an epidemiologist.
Yeah.
And I think it was something to talk to her about it regarding these. I've been reading about a few epidemiologists.
Mm-hmm.
They're so much into the whole virus thing, isn't it? That's the area.
Yeah,
isn't it?
the area is so essentially it's on the virus. They don't just practice on virology, but it's more about society at hand, how you deal with outbreaks, and so on and so forth. So yeah, interesting discussion points, I'm sure, the next couple of weeks, months into entering how we come out of this particular pandemic. So yeah, we'll definitely touch base.
Fantastic. All right, David, is there any last word? Or we?
Well, no, I think I'll just end on asking those persons who are listening and will be listening later on down the track, listening on YouTube and back on Facebook, lobby your MPs, talk to them about the fact that PPE is lacking. We need adequate PPE. And again, it's not just protection of doctors going down the track, but if we are going to enter into needing face masks and such down the track as the general population, that we need to get productivity of that task now, not in 4 months' time, not in 6 months' time. Let's just get on top of it now, and let's get the UK working in efforts to try and provide that for the UK, because we need that now. If we have an excess, we can send that to other countries, and we take it from there. But we need you to operate and lobby your MPs, please.
And also, David, on that last note there, one of the things they were discussing, and I don't know if it was a station, because sometimes I try to pick up a few key things, is that the UK should be in a position, or should have been in a position, whereby it was manufacturing all of these things within the UK, right? Can you imagine that? Because everything is coming, and what they're saying, these things are coming, or importing them from the infected zone in the initial stage. It's a sort of irony. And I one of the things I'm really believing God for is that somehow when this is over, there's going to be a massive boom, because the UK is going to provide so many jobs, so many opportunities, I believe. And I'm looking at the positive side, whereby, the weather's been beautiful. The weather's been beautiful where, people can just go outside and get some vitamin D as well. I know, and I sense that people are also getting frustrated in their homes. As I said, I'm a child care lawyer. I've been in court today for 2 hours, not in court, but remotely. And it's happening because somehow there's so many proceedings where care proceedings are being issued. And there's also the talk about so many domestic violence, mental health issues. So there are so many other kickback effect of staying home. Maybe people can't. Maybe I have to get a psychologist. Maybe you have to get a psychologist to come on and look at all these mental health.
I'll try and find one for you.
Yes,
For sure.
Okay. All right, David. Listen, you take care of yourself, and thank you so much. And stay safe on the front line. And of course, we say people wash our hands, sing happy birthday. Well, somebody said, I'm not doing it twice, I'm doing it 3 times.
Just keep washing your hands for sure.
Keep washing your hands. And but all right.
Stay well. Take care. Thank you.
Thank you, David. Okay, thank you, sir. Bye-bye. Okay, ladies and gentlemen, I want to thank you so much for coming on. Let me see, is that David? Yeah. Thank you so much for coming on today, and want to thank David Burton today, our resident doctor, for joining us. And I hope this was informative. I hope this was very enlightening as well. What we're going to try to do is do this more often as we dissect, maybe at times dissect some of the updates from number 10 and around the world regarding COVID, and try to break it down as much as possible. I will try to break it down with the help of Dr. Burton and his wife Carla as much as possible. But I just realized, as we speaking a while ago, that there'll be that need to get someone who is like a psychologist, someone who is like a counselor on mental health, to sort of break down what does that mean, so people can pick up things around. I must say today, at one point, I was sort of overwhelmed because I was like preparing for a case and just busy preparing. And while I was doing that, and in court, you had a situation where people were just bombarding with all these 5G and all these different texts and message and voicemail. And I kept looking at them. You might be saying, why didn't I turn off the phone? But of course, I have to be listening out sometimes for clients or anything like that. Everything is done remotely. Everything is done remotely. You can't see a client, you can't see the judge, you can't see the boy. And I felt at one point and said, stop this, man, stop this. People need to sometimes stop sending these WhatsApp. And what people need to understand as well is that many people are actually working. They're still working. I remember a lady from intensive care, nurse, and she was saying, "Oh, super, people just telling me these things. I'm overwhelmed, and I just shut off everything because they feel somewhat a bit overwhelmed." So I believe persons need to be very careful and be prudent. Maybe they don't have time on their hands or whatever. Please to sort of stop sometimes sending all these 5G and all these things, So, and then I started to think about it and say, well, what difference does it make if I know or not? What difference really? Is it that I'm going to be someone lost in some ozone whereby I'm lacking of intelligence, lacking of information? You start to wonder about those sort of things, So therefore, I'll read the post too, because I believe it can affect people. People are trying to get their life sorted and going through this whole thing. And this is what I wrote. I said, urgent appeal. Please stop my begging. Do. Those who understand Jamaica, they're going to do. And then I said, I'm totally tired. Please, who is tempted to send conspiracy messages? What is conspiracy right or not? I mean, I believe there's issues about 5G. I have some questions over Bill Gates and stuff like that. But the bombarding of all these things, please stop. The messenger on WhatsApp is crying out, and say sneaky WhatsApp messages that's saying, watch now before they delete it, please, And I sort of emphasize that I'm able to source information just as I did before the internet and social media, and many people can source these information. Some people say block person. I say I don't need to, but maybe I might have to do that. And the most important thing is that some people are working still. Okay. Anyway, that's my little rant right there at the end. SYLBOURNE rant. Remember, wash your hands. Happy birthday twice. If you want to go further, happy birthday 3 times. Remember to like and share this video and let other persons know. Very informative tool from Dr. Burton, and many people will be enriched as much as possible. It will be on YouTube. Remember to also share it as well, and subscribe to my YouTube channel, which is SYLBOURNE TV on YouTube. Don't miss anything. Like the bell as well. I'm saying it again. Like and subscribe. Share this video once you see it right away, immediately. As a matter of fact, share it instead of some of these things. Share it. As a matter of fact, what I've done, every time I get one of these conspiracy messages, I just share the latest video with Dr. Burton and say support and pray for our doctors on the front line as well. Ladies and gentlemen, before anything else I can say, I want to thank you for those who joined today and for those who supported and those who asked questions. All the best and have a good night and stay safe. Thank you. Bye-bye.